We are facing a very dark winter.
Unless we all recommit to the common sense measures that got us past the first horrendous months of this pandemic, we are in for a long, dark winter.
We're about to go into a dark winter, and he has no clear plan, and there's no prospect that there's going to be a vaccine available for the majority of the American people before the middle of next year.
I don't think we're going
to have a dark winter at all.
Without better planning, 2020 could be the darkest winter in modern history.
Joe Biden is promising a long, dark, painful winter. No, he said long, dark winter. Oh, that's great. That's wonderful. That's just what our country needs, is a long, dark winter.
But warning of a dark winter.
There's a need for bold action to fight this pandemic. We're still facing a very dark winter.
Yes, well, I mean, this is the dark winter that Joe Biden was, constantly threatening during the campaign.
Just weeks ahead of what one doctor says most epidemiologists are predicting will be
what we are been calling a dark winter, where a lot of people are going to get infected. We're going to have to go back to crisis mode, which is what we were going through in the summer.
It's time to get that daily news. I ain't watching TV, I'ma log on to YouTube. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe.
But we're not entering a dark winter. We're entering the final turn and approaching the light at the end of the tunnel. That's
I said in March it was going to be a long, dark winter. We're still in that long, dark winter.
In 2001, a real-world exercise tested the emergency response to a bioterror attack on the continental United States. The operation was called Dark Winter. Within just a few days, the simulation spiraled out of control. The operation predicted a rapid breakdown in essential institutions, civil disorder, and massive civilian casualties. Dark Winter has revealed how vulnerable we've become. Our lifestyle, our security, our safety depends on a delicate and unstable economy. We've created a system so complicated that we no longer understand how to control it. Oil, power, shipping, transport. The system is built on a global supply chain that gets things where they're needed, just in time. We've created a house of cards. Remove just one, and everything falls apart. And what's fueling this system?
Money. Did you know that a flu virus can survive on the surface of a banknote for up to 17 days? One day there will be a pandemic. It could begin during the crush of Black Friday sales.
The World Health Organization says that everyone should try and use contactless mobile banking because cash is one of the ways that the virus can spread and spread quickly. But here in Africa, cash is king and not everyone has access to the technology.
A pathogen will jump from tainted banknotes to human skin, onto food, toys, children, and loved ones. By the time patient zero feels the first sore throat, millions of people will already be infected.
In the U.S., the County of Santa Clara Medical Examiner Coroner identified 3 deaths with COVID-19 on February the 6th. That's 23 days before the county announced its first fatality from the virus in Kirtland, Washington, on February the 29th. The county's chief medical officer, Dr. Sarah Cody, said 2 of the individuals had no travel history that would have exposed them to the virus. Cody expressed belief that the novel coronavirus was circulating in the San Francisco Bay Area as early as January. The 2 deaths may have been written off as flu because there were significant numbers of influenza cases at the time. Nearly a month before the first officially recorded cases in Europe, a 42-year-old fishmonger showed up at the hospital in suburban Paris coughing, with a fever and having a hard time breathing. He was later tested positive for the coronavirus. It was December the 27th, 2019. But the first suspected case of a COVID-19 infection in France could date even further back in time. Dr. Michael Schmidt, head of the medical imaging department at the Albert Schweitzer Hospital in East France's Colmar, reviewed 2,456 chest scans performed between November the 1st, 2019 and April the 30th, 2020. According to the retrospective study, the first COVID-19 infections were identified on November the 16th last year at the hospital. Also in November, the mayor of Belleville, New Jersey, Michael Melham, fell sick. He recently shared his experience publicly, saying that the symptoms he exhibited at the time were that of COVID-19. That's over 2 months before the first confirmed case was reported in the US. Melham has tested positive for coronavirus antibodies, further reinforcing his belief. Researchers at the University College London Genetics Institute have published a study titled Emergence of Genomic Diversity and Recurrent Mutations in SARS-CoV-2, and said the pandemic started between October 6, 2019 and December 11, 2019, which corresponds to the time the virus jumped from an animal host to humans. Hoover Senior Fellow at Stanford University, Victor Davis Hanson, also pointed to reports of last fall's flu season that he believes may have been the coronavirus, then unbeknownst to doctors.
Timothy Cunningham was 35, Harvard-educated, and a leading disease specialist at Atlanta's Centers for Disease Control. At his home 7 weeks ago, relatives found his cell phone, car keys, and his dog, but no sign of him. Until now.
The body was found along the bank of the river, and it was found face up. It was stuck in a lot of mud as well.
Cunningham's disappearance made national headlines. Police refuted social media conspiracy theories that the scientist had stolen a virus and fled. Coworkers said on February 12th he was passed over for a new job at the CDC, left work upset, and vanished. Flyers, search teams, and a $15,000 reward produced nothing. On Tuesday night, fishermen spotted a body partially submerged in the Chattahoochee River. Medical examiner Dr. Jan Gorniak.
There was no signs of any foul play. Right now, the preliminary cause of death is drowning, but since the investigation is still open, we do not have a manner of death as whether it's an accident, suicide, or anything other than that.
Authorities say last February they searched the same part of this river where the body was discovered and found nothing. And Jeff, they admit without new evidence, they may never know how Cunningham ended up in the river.
From this point, the breakdown will happen fast.
Day 1, hospitals will reach capacity. Panic will strike. Day 2, quarantine zones will be established. Resources will be rationed. Transport will go into lockdown. Day 3, international trade will stop. The oil will dry up. The stock market will collapse. Day 4, the power will fail. The shelves will be empty. The taps will run dry. And once hunger and despair take hold, people will do anything for survival. By day 5, everyone will be a potential threat.
Operation Dark Winter was the code name for a senior-level bioterrorist attack simulation conducted from June 22nd to Euro 23, 2001. It was designed to carry out a mock version of a cover and widespread smallpox attack on the United States. Tara O'Toole and Thomas Inglesby of the Johns Hopkins Center for Civilian Biodefense Strategies / Center for Strategic and International Studies, and Randy Larson and Mark Demier of Analytic Services were the principal designers, authors, and controllers of the Dark Winter project. Dark Winter was focused on evaluating the inadequacies of a national emergency response during the use of a biological weapon against the American populace. The exercise was solely intended to establish preventive measures and response strategies by increasing governmental and public awareness of the magnitude and potential of such a threat posed by biological weapons. Dark Winter's simulated scenario involved an initial localized smallpox attack on Oklahoma City, Oklahoma, with additional smallpox attack cases in Georgia and Pennsylvania. The simulation was then designed to spiral out of control. This would create a contingency in which the National Security Council struggles to determine both the origin of the attack as well as deal with containing the spreading virus. By not being able to keep pace with the disease's rate of spread, a new catastrophic contingency emerges in which massive civilian casualties would overwhelm America's emergency response capabilities. The disastrous contingencies that would result in the massive loss of civilian life were used to exploit the weaknesses of the U.S. healthcare infrastructure and its inability to handle such a threat. The contingencies were also meant to address the widespread panic that would emerge and which would result in mass social breakdown and mob violence. Exploits would also include the many difficulties that the media would face when providing American citizens with the necessary information regarding safety procedures. Summary of findings: according to UPMC's Center for Health Security, Dark Winter outlined several key findings with respect to the United States healthcare system's ability to respond to a localized bioterrorism event. An attack on the United States with biological weapons could threaten vital national security interests. In addition to the possibility of massive civilian casualties, Dark Winter outlined the possible breakdown in essential institutions, resulting in a loss of confidence in government, followed by civil disorder, and a violation of democratic processes by authorities attempting to restore order. Shortages of vaccines and other drugs affected the response available to contain the epidemic, as well as the ability of political leaders to offer reassurance to the American people. This led to great public anxiety and flight by people desperate to get vaccinated, and it had a significant effect on the decisions taken by political. In addition, Dark Winter revealed that a catastrophic biowarfare event in the United States would lead to considerably reduced U.S. strategic flexibility abroad. Current organizational structures and capabilities are not well suited for the management of a biowarfare attack. Dark Winter revealed that major fault lines exist between different levels of government, between government and the private sector, among different institutions and agencies, and within the public and private sector. Leaders are unfamiliar with the character of bioterrorist attacks, available policy options, and their consequences. Federal and state priorities may be unclear, differ, or conflict. Authorities may be uncertain, and constitutional issues may arise. For example, state leaders wanted control of decisions regarding the imposition of disease containment measures, the closure of state borders to all traffic and transportation, and when or whether to close airports. Federal officials, on the other hand, argued that such issues were best decided on a national basis to ensure consistency and to give the president maximum control of military and public safety assets. Leaders in states most affected by smallpox wanted immediate access to smallpox vaccine for all citizens of their states, but the federal government had to balance these requests against military and other national priorities. State leaders were opposed to federalizing the National Guard, which they were relying on to support logistical and public supply needs, while a number of federal leaders argued that the National Guard should be federalized. There is no surge capability in the U.S. healthcare and public health systems, or in the pharmaceutical and vaccine industries. The exercise was designed to simulate a sudden and unexpected biowarfare event for which the United States healthcare system was unprepared. In the absence of sufficient preparation, Dark Winter revealed that the lack of sufficient vaccine or drugs to prevent the spread of disease severely limited management options. Due to the institutionally limited surge capacity of the American healthcare system, hospitals quickly became overwhelmed and rendered effectively inoperable by the sudden and continued influx of new cases, exacerbated by patients with common illnesses who feared they might have smallpox, and people who were otherwise healthy, but concerned about their possible exposure. The challenges of making correct diagnoses and rationing scarce resources, combined with shortages of healthcare staff, who were themselves worried about becoming infected or bringing infection home to their families, imposed a huge burden on the healthcare system. The simulation also noted that while demand was highest in cities and states that had been directly attacked, by the time victims became symptomatic, they were geographically dispersed, with some having traveled far from the original attack site. The simulation also found that without sufficient surge capability, public health agencies' analysis of the scope, source and progress of the epidemic was greatly impeded, as was their ability to educate and reassure the public, and their capacity to limit casualties and the spread of disease. For example, even after the smallpox attack was recognized, decision-makers were confronted with many uncertainties and wanted information that was not immediately available. Without accurate and timely information, participants found it difficult to quickly identify the locations of the original attacks. To immediately predict the likely size of the epidemic on the basis of initial cases. To know how many people were exposed. To find out how many were hospitalized and where. Or to keep track of how many had been vaccinated. Dealing with the media will be a major immediate challenge for all levels of government. Dark Winter revealed that information management and communication will be a critical element in crisis consequence management. For example, participants worried that it would not be possible to forcibly impose vaccination or travel restrictions on large groups of the population without their general cooperation. To gain that cooperation, the President and other leaders in Dark Winter recognized the importance of persuading their constituents that there was fairness in the distribution of vaccine and other scarce resources, that the disease containment measures were for the general good of society, that all possible measures were being taken to prevent the further spread of the disease, and that the government remained firmly in control despite the expanding epidemic. Should a contagious bioweapon pathogen be used, containing the spread of disease will present significant ethical, political, cultural, operational, and legal challenges. In Dark Winter, some members advised the imposition of geographic quarantines around affected areas, but the implications of these measures were not clearly understood at first. In the end, it is not clear whether such draconian measures would have led to a more effective interruption of disease spread. What's more, allocation of scarce resources necessitated some degree of rationing, creating conflict and significant debate between participants representing competing interests.
It's time to get that daily news. I ain't watching TV, I'ma log on to YouTube. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Talking about that raw, uncut news. You a fool. You believe that mainstream and local news. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. And 411, keep the 411. On a sensitive subject, keep it 100, don't bite no tongue. If you cannot take the truth, then this is finna hurt. Who's to say if it's a round or a flat earth? Stick to the facts, what's some feelings? I don't do no capping. Read that paper, seen that news, now you know what happened. Playing a pretty picnic, but they control that weather. Same crisis actors, like we don't know no better. Thing about the truth always come to the light. Pile of me is too many, all bark, no bite. Like muscle, no might. I don't know what happened to them, but I know the way they said, somebody that ain't right. It's time to get that daily news. I ain't watching TV, I'ma log on to YouTube. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Talking about that raw, uncut news. You a fool. You believe that mainstream and local news. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe.
And we thank your families who exhibit a very special kind of courage, knowing you are headed into the breach to save others.
Our Air Force and medical airmen are partnering with other American heroes and our international teammates to meet the challenge this pandemic has placed before us.
It's just not safe. And it might not be safe for a while yet.
A dire warning this week from Wisconsin Governor Tony Evers as the coronavirus pandemic rages across the U.S. New COVID-19 infections hit a record 142,279 on Wednesday, the 8th day above the 100,000 mark, according to a Reuters tally. The number of hospitalizations also surged to a record of at least 64,939. There were 1,464 deaths on Wednesday, the most since summer. The White House seems to be sitting silently by. There's been no new action or announcements for weeks, even as new cases soar. House Speaker Nancy Pelosi was outraged at her weekly press briefing on Thursday. Without any leadership on the federal level, state governors are stepping up. In Wisconsin, Governor Evers urged citizens to stay home as much as possible, only leaving to get food, medicine, or to get tested.
Wisconsin, this is serious. The crisis is urgent.
And in Indiana, where hospitalizations are at an all-time high, hospital officials expect the numbers to double over the coming weeks. Governor Eric Holcomb is limiting activity county by county.
Because our frontline medical personnel, our nurses and assistants and doctors, they're exhausted and overwhelmed and need us all to do the things that we can on the outside that will slow the number of patients that need hospitalization.
Hospitals in Lubbock, Texas are so overrun, 2 of them are setting up mobile medical tents. In the neighboring states of New York and New Jersey, restaurants, bars, and gyms have been ordered to close at 10 p.m. And in the state of Illinois, Chicago Mayor Lori Lightfoot issued a 30-day advisory calling on residents of America's third largest city to stay at home and cancel plans for Thanksgiving.
We do not step up and do the things that we know actually work to protect ourselves, to protect our families, protect people in our network, protect our colleagues. By the end of this year, we will lose at least 1,000 more lives in this city.
Doctors in other states are also urging Americans not to have large Thanksgiving gatherings this year.
The strongest advice is don't gather with people outside of your household this Thanksgiving.
For some Americans looking forward to the holidays to bring some joy during a tough year, the pandemic may have taken that away.
Winter. The news about the vaccine is very, very encouraging. Frankly, the level of possible protection offered by the Pfizer vaccine that was announced last week is higher than we all expected. But it is going to take time to complete the studies and to get the vaccine out to the people who need it, first to the priority groups at most risk, and then to a broader population.
What steps would you take to give Americans confidence in a vaccine if it were approved?
Make sure it's totally transparent. Have the scientists of the world see it, know it, look at it, go through all the processes. And by the way, this is the same fellow who told you this is going to end by Easter last time. This is the same fellow who told you that, don't worry, we're going to end this by the summer. We're about to go into a dark winter. And he has no clear plan, and there's no prospect that there's going to be a vaccine available for the majority of the American people before the middle of next year.
President Trump, your reaction, he says you have no plan.
I don't think we're going to have a dark winter at all. We're opening up our country. We've learned and studied and understand the disease, which we didn't at the beginning. When I closed and banned China from coming in heavily infected, and then ultimately Europe, but China was in January. Months later, he was saying I was xenophobic. I did it too soon. Now he's saying, oh, I should have, moved quicker. But he didn't move quicker. He was months behind me, many months behind me. And frankly, he ran the H1N1 swine flu, and it was a total disaster, far less lethal, but it was a total disaster. Had that had this kind of numbers, 700,000 people would be dead right now. A far less lethal disease.
Remember the swine flu scare of 1976? That was the year the U.S. government told us all that swine flu could turn out to be a killer that could spread across the nation. And Washington decided that every man, woman, and child in the nation should get a shot to prevent a nationwide outbreak, a pandemic. Well, 46 million of us obediently took the shot. And now 4,000 Americans are claiming damages from Uncle Sam amounting to $3.5 billion because of what happened when they took that shot. By far the greatest number of the claims, 2/3 of them, are for neurological damage or even death, allegedly triggered by the flu shot.
This virus was the cause of a pandemic in 1918 and 1919 that resulted in over 500,000 deaths in the United States, as well as 20 million deaths around the world.
When in November of 1976, she took her shot. 2 weeks later, she says, she began to feel a numbness starting up her legs.
I joked about it at that time. I said I'll be numb to the knees by Friday if this keeps up. By the following week, I was totally paralyzed.
So completely paralyzed, in fact, that they had to operate on her to enable her to breathe. And for 6 months, Judy Roberts was a quadriplegic. The diagnosis? A neurological disorder called Guillain-Barré syndrome, GBS for short. These neurological diseases are little understood. They affect people in different ways. As you can see in these home movies taken by a friend, Judy Roberts' paralysis confined her mostly to a wheelchair for over a year. But this disease can even kill. Indeed, there are 300 claims now pending from the families of GBS victims who died, allegedly as a result of the swine flu shot. In other GBS victims, the crippling effects diminish and all but disappear.
Curfew is now in effect. All unauthorized citizens must stay indoors.
Tensions rise as we enter the 213th week of lockdown.
A grim new reality emerges.
COVID-23 has mutated.
Beginning thermal scan. Thermal scan normal.
A horrifying new development
New
today.
data confirms the virus attacks the brain tissue.
Hey, whoa, 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 whoa! I'm immune! I'm immune!
Worldwide death toll rises to over 110 million.
All infected Americans are being forced into quarantine camps.
Sarah. Sarah, what's going on?
Department of Sanitation.
Sarah, talk to me.
I think my neighbor has a fever.
It'll be so much easier if you just open the door. Mrs. Grant, you have visitors.
Sarah, please. Sarah, open that door. Sarah, do not open that door.
The paper also identified nearly 200 recurrent mutations that the researchers believe are helping the virus evolve.
Scientists have been expecting the virus that causes COVID-19 to mutate, and there is now new research that suggests one of the dominant strains, the strains found here in Canada, is in fact mutating and is in fact now more infectious.
Scientists have discovered hundreds of mutations to the virus that causes COVID-19. Researchers in the UK found almost 200 recurrent genetic mutations, which could mean a more contagious strain of the novel coronavirus.
We need to make sure that our army is ready to go to war. And we're going to make sure that our soldiers are ready. We have an obligation to do that, so they will continue to train. And as of this morning, we have 14 out of our 15 urban augmentation medical task forces employed. We'll manage the risk. We don't have a vaccination right now, and we are training soldiers. And we are going to continue to train soldiers in a safe environment with very, very strict measures that we talked about, from social distancing to screening to testing. And, again, we need to make sure that our Army is ready to go to war. And we're going to make sure that our soldiers are ready. We have an obligation to do that, so they will continue to train. We do have the testing capability. They've just received 2 of the Gen X 16 machines, along with 2 of the BioFire machines, so they do have the capability up to about, I think it's about little over 700 testing capability a day, and that will give them the capability that they need in the future to make sure that we can maintain the safety of the new recruits. They have 4 systems in place right now at Fort Jackson. Two are called the BioFires. The BioFires do 24 a day each, so you got 24 a day each, and then they have 2 of these brand new Gen X 16s, and they're called 16s because they do 16 an hour. So if you times 16 by 24 and multiply that by 2, you get a little over 700. And then the capability is that's part of it. So you have the machine that has the capability to actually process the tests, and they can do that right there and fairly quickly.
She says as they test more members of the African American community, a mysterious trend is emerging. The black community has a much lower rate of infection.
We've tested close to 900 people at this point, and we've had 5 positives.
The problem is, for black people who do contract the disease, the death rate is much higher than usual. Dr. Rhodes says that may be physiological or the result of inferior health care options. She's not sure. It hasn't been studied.
Is a new request, this one from the federal government, for a data sharing agreement before the receipt of any vaccines.
They want the name, they want the address, they want the date of birth, they want the ethnicity, they want the race, they want the sex, and then they want the ID number.
The governor says the ID numbers refer to passport, driver's license, and social security numbers. He also adds the agreement states the information would be used by the CDC, HHS, and other federal partners.
The coronavirus is one of the biggest threats to U.S. national security. With the number of cases in the U.S. growing larger than China or Italy, the government is taking drastic measures to fight the disease. President Trump activated the National Guard in California, New York, and Washington to help combat the spread of the virus. The administration emphasized that activating the National Guard is not an indication of a plan to move toward martial law. Some fear coronavirus may be used as an excuse to limit civil liberties in America. Others say the declaration of martial law would be ineffective in combating the disease and an abuse of power. While enforcing a quarantine or social distancing orders during the coronavirus outbreak may feel like an infringement on civil liberties, it does not negate the presence of a judicial system and therefore does not suspend habeas corpus. As of early April 2020, over 30,000 Air and Army National Guard members have been supporting coronavirus response efforts at the direction of their governors. They have helped build and outfit nearly 150 alternate care facilities, providing 83,000 extra beds.
You know, we heard some doctors yesterday warning the CDC yesterday in that meeting that public health officials and drug makers need to be transparent about the side effects that people may experience after they get that first shot of the vaccine.
Yeah, I mean, there has not been a very strong communication plan coming out of Operation Warp Speed. Operation Warp Speed's been great in terms of scientific rigor and the integrity of the clinical trials, but there's been no communication strategy. It's all been left to the pharma CEOs, and more often than not, they've really fumbled on the message. So that has to be corrected, and pretty soon. You know, the side effects can be unpleasant. It's often, some say, more the second dose than the first dose, so people have different experiences. It's usually pretty transient, maybe low-grade fever, muscle aches and pains, fatigue. It shouldn't last more than a day. You know, and rare individuals, it will be more substantial. Those of you who've gotten the Shingrix vaccine, if you're over, I think, the age of 60, then people have reported similar effects. It's very manageable, and you can medicate yourself with anti-inflammatories such as ibuprofen or potentially Tylenol on the advice of your physician. But it can be unpleasant for a day or so for most people, but remember how life-saving it is. 95% effectiveness to keep you out of the hospital or the intensive care unit for the Moderna vaccine or the Pfizer vaccine. Now we have the new AstraZeneca vaccine, maybe slightly less level of effectiveness, but we don't know anything about durability of protection, so it'll all kind of even out in the wash. The point is, get your vaccine, save your life, save the life of your loved ones. This is a very tiny price.